Hello everyone, myself Darshana Joshi. I am studying in second year of BHMS at Anand. I will teach you human anatomy, which is the part of first year of any medical field. I will start teaching from section 2 or volume 2 in ANAT, which is lower limb, abdomen and pelvis from BD Chaurasia book. I will teach you some IMP topics of human anatomy which important for your university exams, and after completing I teaching, I will provide you some notes which can help you writing in your university exams, especially for Gujarati medium students and Hindi medium student and also English medium student. So without wasting time, I should start with learning you people from chapter 3 in lower limb. In chapter 3, first MP topic is femoral triangle. Femoral triangle, it is situated in front of thigh, which contain a 1/3 part of front of thigh and situated below the inguinal ligament. This figure shows the femoral triangle in front of thigh. Femoral triangle has a boundary. Three boundaries are there. First, medial boundary, lateral boundary, and one boundary made up of the base. So, medial boundary made up of the medial border of the adductor longus muscle. Lateral boundary made up of the medial border. This one is the medial border of the sartorius muscles, which is the longest muscle of the thigh or lower limb, and base is made up of the inguinal ligament, and triangle contain one apex which made up of by the two muscles where crosses to each other. So those muscles are sartorius muscle and adductor muscles with where crosses to each other and made up of and make the apex of the femoral triangle and continuous with the adductor canal. So roof of the femoral triangle and floor of the femoral triangle. Next topic is, so roof of the femoral triangles is covered by the skin, superficial fascia and deep fascia. Superficial fascia contains a inguinal lymph nodes, ilioinguinal nerve, genitofemoral nerve which is branch from the femoral nerve, and great saphenous vein. Then comes to the deep fascia. Deep fascia contains a saphenous vein opening. So now further going to floor of the femoral triangle. Femoral triangle is formed medially by the adductor longus pectineus and laterally by the psoas major muscle and iliacus muscle. Floor of the femoral triangle made up of four muscles: medially adductor longus muscles and pectineus muscles, and laterally iliacus muscle and tendon of the psoas major muscles. This green one is the tendon of the psoas major muscles. So now we will learn about the content of the femoral triangle. Femoral triangle contains artery, vein and nerves and lymph node. So first, femoral artery. This figure shows the content of the femoral triangle. Femoral triangle contains femoral artery which extend from the inguinal ligament to the apex of the femoral triangle. This artery, which is name is femoral artery, gives three superficial branches in femoral triangle and gives three deep branches in femoral triangle. Then comes to femoral vein. Femoral veins has many tributaries received from other parts of the thighs and legs. Femoral veins lies to medial to the femoral artery. It receives vein from the great saphenous vein, circumflex vein, and veins corresponding to the circumflex femoral artery. Then going to the nerves of femoral triangle. Femoral triangle has a femoral nerve which gives a many branches in femoral triangle. Femoral nerve lies laterally to the femoral artery, and separated from the femoral sheath. Femoral nerve gives many branches in femoral triangle, which we will learn further in femoral nerve topic. So we are going to one another content of femoral triangle, which is deep inguinal lymph node, which is lies to the medially to the femoral vein, and it receives lymph from the superficial inguinal lymph nodes and glands penis and clitoris and deep lymphatic of the lower limb. Then comes to the femoral sheath, which covers the femoral artery, femoral vein, and genitofemoral. Now, femoral sheath is a funnel shaped sleeves. Femoral sheath is a funnel shaped sleeves enclosing the artery, vein, and genitofemoral nerve branch of the femoral nerve. Extend from the inguinal ligament to 3 to 4 cm from femoral vessels. It has a anterior wall, posterior wall. Anterior wall is formed by the fascia transversalis, which is fascia of the part of abdominis, and posterior wall is formed by the fascia iliaca, which covers the iliacus muscle. Inferiorly, this sheath is connect with the connective tissue around the femoral vessels. Now comes to septa in the femoral sheath. Femoral sheath has a 3 septa in its content. First is lateral or arterial compartment, which contain a femoral artery and femoral branch of the genitofemoral. Now, this one is the lateral septa. This one is the lateral compartment, which contain femoral artery and femoral branch of the genitofemoral nerve. Then second compartment is intermediate compartment or venous compartment, which contain a femoral vein. This one is the intermediate compartment or venous compartment, which contain femoral vein. And last one is the medial or lymphatic compartment, which contain a femoral canal, and in femoral canal deep inguinal lymph nodes are there. So now we will going to learn about femoral canal. So femoral canal is the medial compartment of the femoral sheath. It contains a conical shape, being wide above at base and narrow at below. It is 1.5 centimeter long and about 1.5 centimeter wide at the base. Now, femoral canal has a base or upper end of femoral canal is called in femoral ring. Femoral ring contain of inguinal lymph node, and it is bounded anteriorly by the inguinal ligament, anteriorly femoral canal or femoral ring bounded by the inguinal ligament, posteriorly this one is the posterior part of femoral ring is bounded by the pectineus and its covering fascia, and medially concave margin of the lacunar ligament, which is a ligament of medial compartment of thigh, and laterally covered by the lateral septa of the femoral vein. Inferiorly, epigastric vessels are closely related to the junction of ring and septa, and femoral canal contain lymph node like Rosenmuller lymph node. This femoral canal contains Rosenmuller lymph node and lymph node of glans penis in male and clitoris in female. So this figure is about the asymmetrical femoral sheath. This figure about the femoral sheath enclosing the part of femoral vessels, and this one is content of the femoral triangle and floor of the femoral triangle. You should draw in your exams this figure, and this asymmetrical femoral sheath figure. Now we comes to the clinical anatomy of femoral triangle. First clinical anatomy is the femoral hernia. It is the content which is bulging out. Femoral hernia is a content of abdominal which is bulging out from the femoral triangle, and it mostly seen in female because of their wide pelvis and smaller size of the femoral vessels in the female. Now comes to second clinical anatomy. If there is any injury to the femoral nerve resulting to the sensory loss on the anterior compartment of thigh and medial compartment of the leg, then lateral cutaneous nerve, which is branch of femoral nerve, if there is any damage or integrated in inguinal ligament, so it's lead to meralgia paresthetica, which means sensation loss of lateral of thigh. The femoral artery is exposed in adductor canal for various surgical procedure. We are completing our topic femoral triangle. Now I will give you my notes. You can take screenshot for writing purpose. So we should stop stitching here. Thank you all of you.